Welcome back to our channel. I'm Valerie.
And I'm Diem.
And today we are continuing our discussion on breast and axillary surgery. So in our previous video we did talk about breast surgery, and now we're going to focus on the surgeries that can be done to your armpit once you've been diagnosed with breast cancer.
So when you have breast cancer, in almost all of the cases, your surgeon will need to sample the nodes in your axilla. The reason why he or she needs to do that is to be able to first stage your disease. Secondly, that helps them decide on the type of treatment you have. And if you have disease in your axilla, it clears your disease or
the disease burden. Right?
Exactly.
And so can you explain to us briefly how does the lymphatic system work?
Okay, so the lymphatic system, so the lymph nodes in your armpit actually drain different areas. They drain your arm, which is important to know because of the complications you may have from this surgery. They drain your breast, and they also drain your back. Now, what the theory behind the nodal sampling is that we want to know if the tumor that is situated in your breast has the propensity or the ability to go elsewhere. And when your tumor goes elsewhere, it will migrate through the lymphatics or the blood.
Right.
And when it migrates through the lymphatics, the theory is that it will go to your axilla. So sampling your axilla actually allows us to know if your tumor, sort of the aggressivity of your tumor, is it aggressive enough to be able to go elsewhere, and that will tell us what to do with your treatment afterwards.
Exactly. Okay, so tell us about the different procedures that can be done for the armpit.
So you can have two types of procedures for the armpit. You can have a sentinel lymph node biopsy, or you can have an axillary lymph node dissection.
So let's start with the sentinel lymph node biopsy. Can you tell us what that is?
Yes, so a sentinel lymph node biopsy is basically a sampling of the first node that guard your axilla. Therefore, we call them the sentinel. Now, the theory behind that is that in your axilla, your nodes are organized kind of like an army. So you have the sentinel, the guardians at the front, and the rest of the army at the back. And if cancer was to attack that army, the first ones to be attacked would be the sentinel. So therefore, by removing them and analyzing them, we have an idea if cancer has arrived to your axilla.
Okay, so tell us, how is the procedure done?
Two ways to actually tag the lymph nodes in your axilla. And your surgeon might choose to use one or both of these. Now remember, whether they use just one or both, this does not affect the quality of your surgery or your outcome. But it basically just depends on the surgeon preference. There's two dyes that your surgeon can inject. The first one is a blue dye that we inject in your breast just about 10 minutes before the incision. So it's injected once you're asleep.
Okay.
And the second dye that we inject is a radioactive dye that needs to be injected at least 2 hours before your surgery.
Okay.
Both of those dyes are injected to your breast. The breast is then massaged, and the dyes will migrate using the same paths that cancer would use if it were to go and deposit itself into your lymph nodes.
Okay.
So we do that the day of your surgery. Now, once you're being put to sleep, the surgeon will make a small incision at the base of your axilla and get into the cavity where your lymph nodes are. The surgeon will either use their eyes to identify blue nodes or a probe that detects radioactivity to identify the radioactive nodes. These nodes are then removed and they are sent to the pathologist for analysis.
Okay, and how many lymph nodes are removed?
So the number of sentinel lymph nodes you have really varies from one patient to the next. It can go anywhere from 1 to 6 or 7. That's very rare though. Generally speaking, most of the patients I say would have between 2 and 4 lymph nodes removed.
Okay. So what are the risks and complications of sentinel lymph node biopsy?
So the risks and complications are actually quite small. Obviously, you're being put to sleep because this is done oftentimes on the same day as the surgery for your breast. You will also have a small risk of bleeding and infection, very small. And you also have a small risk of skin numbness after your surgery. Now, this is due to the fact that there are nerves that go through the lymph nodes area to innervate the sensation on your skin. And so if these nerves are either cut or they're stretched or they're inflamed during the surgery, you may feel numbness afterwards, and this can be permanent, but very rarely.
Okay, so either temporary most of the time or otherwise permanent.
Yes, and you remember before when I said it also drains your arm?
Yeah.
So in this case, once we take out a few lymph nodes, you may have a risk of lymphedema, which is a swelling of your arm because the lymphatics don't drain as well as before. But the risk for a sentinel lymph node biopsy of lymphedema is actually quite low. I would say it's about 3 to 5%.
Okay. Tell us, what are the indications for a sentinel lymph node biopsy?
So a sentinel lymph node biopsy can only be done, well, first of all, the first indication for sentinel lymph node biopsy is if you have a breast cancer.
Right.
And the second thing is that if you do have breast cancer, you have to not have proven disease in your axilla to be able to do a sentinel lymph node.
So all the investigation before surgery has not shown that you have a positive lymph node. Now that we have covered the sentinel lymph node biopsy, explain to us what is the axillary lymph node dissection.
So an axillary lymph node dissection is when you remove all of the lymph nodes underneath your armpit. Now, the indication for this procedure is if you have proven disease there. So let's say a patient who comes with a palpable node and on biopsy it has shown to have disease, or a patient who had sentinel lymph node biopsy and the final pathology meets the indications for an axillary dissection.
Can you explain to us how is the axillary lymph node dissection done?
Yeah, so the axillary lymph node dissection is actually a procedure that can be done at the same time as your surgery for your breast on the same day, but sometimes it's done as a return procedure. And what the surgeon does is that he or she will make a small incision again at the base of your armpit, enter into the cavity, and remove all of the tissue inside your axilla. So that includes some fatty tissue, and in those are embedded your lymph nodes. You will then have a drain that is left behind for draining all the little lymphatic liquid that can accumulate in the area. And this procedure can be done as a day procedure as well. And of course, it's done under a general anesthesia.
So can you explain to us what are the risks and complications for the axillary lymph node dissection?
Yes, it's actually a procedure that has a quite high risk of morbidity. Back in the days, it was the only thing used to sample the nodes in the axilla.
Meaning the sentinel lymph node biopsy
did
was
not
done.
exist.
Right.
And so patients had quite a lot of complications from that. It is used less often nowadays because we have the sentinel lymph node dissections. But for those patients who do require an axillary lymph node dissections, their risks and complications are quite higher. Now, these include obviously the risk of bleeding and infection. And because the surface area of the dissection is much bigger, your chances of having a bleeding or an infection afterwards are higher. Now, the bleeding can be also a hematoma that forms, which is a collection of blood. You can also have a risk of seroma, which is a collection of lymph fluid, because obviously you cut a lot more of the little lymphatics to remove the tissue. And you also have a higher risk of loss of sensation underneath your armpit. And the reason why is that all the nerves that go to your skin to give you the sensation underneath the skin actually crisscross across the lymph nodes. And when we do the axillary lymph node dissection, because you have disease there, we have to make sure all of the disease is removed. So oftentimes those nerves will all be cut during the dissection. So the numbness that you feel after the surgery has a higher chance of being permanent. And the last risk I'm going to talk about is the risk of lymphedema. And the risk of lymphedema in the cases of axillary dissection is about 10 to 20%, especially higher if you're going to have radiation to the area afterwards, because all of your lymphatics have now been cut, and sometimes they're further damaged by the radiation. And because they also drain the arm and they are basically blocked or malfunctioning now, the lymph can accumulate in your arm and cause lymphedema. And we will have a video on the lymphedema to describe what it is, how to treat it,
management, and so forth,
etc. Yes.
Okay. Excellent. So I think we've covered everything we wanted to discuss with regards to the surgeries you can have in the axilla. Once again, we hope that this video was educational for you. If you do have questions, leave them in the comment box below and we will certainly address them.
Thank you for watching, and we'll see you next time.